Morning, it's KISS92 with Maddy, Jason and Arnold, joined by Dr. M Yuen, who specializes in skin and aesthetics. Hello, Dr. Yuen.
Morning everybody.
Morning.
Hi.
First time on our show, very happy to have you.
Thank you for having me.
Now, I hear that you're a strong believer of preventive aesthetics. I mean, what exactly is that?
Right, I think preventive aesthetics basically means how to age gracefully,
Right.
how to make somebody look beautiful naturally,
Right.
without altering too much of their so-called DNA.
Right.
Yeah. So by preventive aesthetics, we mean proposing to somebody, a patient, to start on anti-aging early when they're younger, so that when they grow older, they do not notice too much of problems.
And they don't have to do radical,
the radical stuff or
stuff to change.
really serious stuff,
Right.
to
How
change.
young is young?
Actually, technically speaking, as long as you are licensed to get married, I think you can do aesthetics. Yeah, generally for us, I think anybody below 16 to 18, we would seek parental consent.
Right.
And I think 18 and above, we generally will be open to treatment,
Right.
to offering
But
treatment.
do you get patients who come to you and want to do more than you think is necessary? Is that
Yeah,
common?
that's very common.
It's very common.
Yeah, and I think the problem comes from the internet.
Right.
Because ladies, when they're in the office, they turn on the computer and they start Googling, looking young, prettier, beautiful nose, sharper chin. And then the problem is that it's very hard to sieve through the tomes of things on the internet and decide what's good, what's
Right.
correct, what's wrong.
Okay.
So they think that, by just visiting a doctor and just telling the doctor they want to look better, and then everything will be solved. But they don't understand that actually there are some things that do not need to be done or it's not suitable.
Right.
So I think the problem comes with too much information being on the internet.
So
Yes.
how should someone be going about doing research for this then? Do you have any suggestions?
Okay. My favorite suggestion is to first look at yourself in the mirror and think what kind of patient are you? There are a couple of patients that in my mind I tend to classify them. The first are those patients who have an active skin problem, be it acne or pigmentation. So there is a problem.
Yeah.
So they're not out to look beautiful. They know they have a problem. They need to solve it. The second group of patients are patients that actually do not have a problem. They just want to look better.
Right.
So they just want to age better and remain youthful for as long as they can.
Who doesn't want that, right?
Yeah. And the third type of patients are patients who actually are just wanting to enhancing their features. They're happy with the skin. They just want a sharper nose, a sharper chin, a fuller cheeks. And the fourth kind of patients, the last group of patients, are very interesting. They don't know what they want. So I think
they come to you, doc, I have a problem. What's the problem? I don't know.
So that's actually the most challenging, but also very interesting. So I think it helps a lot. It helps a lot if you are a patient to first think about these four things. So once you know which group you belong to, it's very easy. So let's say I think I only want a sharper nose. I look for nose enhancement. And everything about nose enhancement will come out on Google.
Okay.
And we go into the medical websites. So don't look for forums, and because you don't know who are those people who are writing. They can say anything they want, good, bad, ugly, you don't know. Look for the medical website.
I'm with
doctors'
you,
websites.
doctor.
Yeah.
So
Overseas websites.
Of the four, do you treat all four or do you just concentrate on
I treat all four if I think they make good candidates
right?
to be aesthetic patients, yeah.
We're talking to Dr. M Yuen, who is an aesthetic and skin doctor here on KISS92 with Maddy, Jason and Arnold in the morning. Doctor, do you get a lot of patients coming to you with a printout of, say, maybe a picture of Angelina Jolie or Kim Kardashian and
Yeah,
say,
it does happen.
"Doc, I want to look like that."
It does happen
What do you tell them?
sometimes. Well, actually, first thing I will tell them, I think everybody is different. We should not try to look like somebody else.
That's great.
But we can pick up features that we think we like in someone else that we see. I think there's nothing wrong with that. I think the essence is that we have to be proud of what we are, and not try to replicate ourselves.
So it's like
fine.
being the most beautiful version
of
you.
yourself.
Yeah.
Yes, correct.
Yeah.
Or let's say there's certain features or certain angles that you're not looking, you know that you don't look so nice. We can enhance those angles and those features so that you look more perfect, so to speak.
Obviously, you would provide some guidance, so you become a bit of a fashion
Yeah,
beauty
we have
counselor
to,
as well. At the
correct.
same time.
And sometimes actually it's not just the face. It can be simple things like redoing their hair, changing their glasses, or even the clothes that they wear.
You do that too?
Sometimes.
Wow.
So what kind of a
Sometimes.
degree do you have again?
Multiple degrees.
A multiple degree.
So is
obviously.
this something you've always been interested in? Is
I
human
think
beauty
so.
and
Yes,
aesthetics
yes.
and
I
stuff
mean,
like
because
that?
I like
So you
to
have to
look
bring
at-
an artist's eye to it.
Yeah, yes. I think aesthetics is very interesting, and the reason why I chose it is because it's perhaps the only specialty in medicine that is both art and science.
That's interesting.
Yeah, actually, when we study medicine, when we go to medical school, the first few things they teach you is that medicine is not science.
Right.
It's actually an art,
Oh.
right? Because dealing with human beings and their illnesses requires you to be an artist. You see, but it's not. Nothing is as apparent as in aesthetics because it's really art. art. You have to see things in an artistic viewpoint.
I would imagine that being, in the business that you're in, sometimes you're torn between, telling a patient he or she doesn't actually need the treatment and obviously earning money from this person, So, I mean, how do you deal
reconcile
with that?
that?
Yeah, how do you reconcile
Yeah,
that?
actually it's quite easy because my first philosophy, even I always tell my staff and even my patients that I think we are doctors first. And I always remember what my professor used to teach me when we were young, that once you think about the patient's interest first, everything else will fall into place. But once you think about money first, then nothing else will fall into place.
Do you think most doctors think like this? Or?
I hope so.
I hope so too.
I think Singapore doctors are generally very well trained.
That's right.
Yeah.
Okay.
That's good to know.
Yeah, that's good to know.
And, let's just talk about the what ifs. If there's a minority, perhaps, I mean, what information do they sometimes leave out?
Oh, in terms of when they consult
That's
the patient.
right, yes.
I think a lot of times is being human beings, I think we tend to overpromise. I think it's very important to remind yourself, if you are a practicing doctor, that you should never overpromise a patient the results. And when we do non-invasive aesthetics, actually the biggest ally we have is actually time. With time, we can do a lot of good things. You see, unlike, let's say, plastic surgery is, one day in, one day out, you look different already. But medical aesthetics, you're using lasers, you use radio frequencies, ultrasound. That takes a lot of time, but you can get the result. But you need time, you need commitment of time, and also a little bit more money.
Okay, so don't go for quick fixes is what you advise.
Yeah. If you are looking for non-invasive, then there's really no quick fix. Apart from Botox and fillers. Botox and fillers are injectables. They are minimally invasive. So
you do
get
those ones as well?
Yeah, I do. Those are not surgical, and you can get a quick result from that.
Do you try to be careful with the Botox? Because I think a lot of celebrities have become famous for having like the
Over
immobile
Botox?
expression.
Yeah. That's no longer in.
It's been overdone, right?
Yes, overdone.
Too many horror stories. So Botox is out. What is in?
No, Botox is still in, but it's how we use Botox. 10 years ago, when Botox was first in the market, it was very much the realm of people who could afford it.
Yeah.
So it became like a status symbol.
Right.
So I had to show people that had a Botox face to tell people that I can afford to see a doctor for Botox, right?
Yeah.
So it's very obvious from afar, that lady has got Botox forehead.
Yeah.
I think 10 years on, it has changed very much. People don't want people to know that I've done Botox. So the Botox is still very powerful, a very useful tool to look good, but you do it very judiciously, so sparingly, and you do it properly. And try to basically...
Tasteful.
Yeah, tasteful.
Right.
So when it comes to Botox, more of the story is less is more.
Yes, less is more. That's absolutely right.
Is that the most common treatment that Singaporeans ask for?
Yes, one of the most common treatments is Botox, because it's got very good medical uses and it's very well proven and it's very safe.
Oh, wow. Okay. Well, that was Dr. M Yuen. Thank you so much for joining us.
Thank you.
And we hope to have you back again next time.
Thank you.
KISS 92.